Okay, it's time to talk about Medicare Advantage Plans, also known as Medicare Part C. This is the other part of the puzzle. We already talked about Medicare supplements. You already know that Medicare is still your primary payer. With them, you know that there's different supplements available to you depending upon how much you want to spend per month and how much you want to take out of your pocket when you use the insurance. You also know that with Medicare Supplement, they do not cover prescription medications. You'll have to add a standalone Part D drug plan to them. Medicare Advantage plans are completely different. Okay, when you go on to Medicare Advantage plans, Medicare ceases to be your primary. It becomes secondary, and the insurance company will now be your primary, which is why you have to use their doctor and hospital networks. Some of the networks are quite large. As you remember looking at the plan information on the supplements, they're maybe 2 pages, maybe 3 pages long. Medicare Advantage plans, they're 30, 25, 30 pages, the booklets, because there's copays for everything you do. So what I did was I put together just a short presentation on a plan, a typical plan book. They're all basically the same because it's standardized coverage again. Only now the differences between the plans will be maybe in what you pay for certain services. So here is a page out of a plan book. And again, we're not talking about specific plans. I'm just trying to give you an idea of the differences between a Medicare supplement and a Medicare Advantage plan. You're looking at the first page on a Medicare Advantage plan. And you'll notice right away, these supplements all had premiums. This plan does not. Some Advantage plans do have premiums, but for the most part, they don't have a premium. This particular one doesn't have a deductible. If you'll notice the third item down, Pharmacy Part D, it includes a drug plan, all for the zero. If you look at the out-of-pockets, $7,200 in-network, $11,000 out. That's just if you begin to have a lot of serious issues, multiple MRIs, multiple hospital stays. If it adds up to, say, $7,200 in-network, you will no longer pay. One of the reasons why people get on a health plan is because there's no limit what you can spend with Medicare. When you have a health plan, it caps it off. If you hit 72, very hard to get there, but if you hit 72, the plan will continue to pay and you will no longer have any copays. So as you start going down, you can see with the Medigaps, you're looking at, a lot of times you're not paying anything if you go in the hospital. With these plans, when you look at this, it's a $395 per day copay for the first 5 days. You need outpatient surgery, $365. Outpatient surgery at an ambulatory center is $300. There's your doctor stuff. Primary care, you don't have a copay, but a specialist, you're going to pay $50. The whole idea behind me showing you this is that you can see that with one plan, you can invest some money at the beginning of the month, Medigap, or if you don't want to spend anything per month, and sometimes it's a little bit of a hardship to do that, you sign up for Medicare Advantage, but now you're going to spend a little bit of money when you do use it. Mental health, $374, outpatient therapy. If you look at skilled nursing, you're not going to have anything for the first 20 days, which is really just mirrors Medicare. After that, it's $196. Physical therapy, $20. You got some foot exams in there. Ambulance, $290, as you can see, and 20% on chemo. That's where it can get a little bit expensive. But as you can see, there's co-pays for everything you do. I've kind of shortened this. There's a lot more to it, but I'm just trying to give you a feeling for what the differences are between the two plans, Medigap and Medicare Advantage. You got to go for the emergency room, urgent care, $25. Then you get down to the diagnostic stuff, diagnostic mammography, diagnostic radiology. Look at lab services. By the way, other plans are different. This is just this particular one. For example, diagnostic radiology, you've got a range of $0 to $350. On some plans, it's actually the Medicare 20%. Other plans, it's a flat copay of, say, $200 instead of the range. So this is just one way that they can be done. This particular plan gives you some hearing coverage. So that's pretty much, just to show you a few more things here. Rehabilitation, you've got telehealth services available. A lot of the plans provide that, but there's copays associated with everything you do. So knowing this does help you get into a frame of mind as to what type of plan you're going to be interested in getting. I don't espouse any plan over another. It really comes down to what is going on with an individual at the time they're getting ready to sign up. if they need to go to certain places, if they're having multiple issues. Some people are having a lot of issues when they start getting on Medicare. So sometimes it pays to just go right into a supplement and put a lid on really what you're going to be spending as you're using the insurance. For the average person, Medicare Advantage is fine. They're actually both fine because it's all based on Medicare anyway. So I hope that was helpful. It gives you a little bit of a comparison between that and the supplement plan. All right, we'll continue.